Hello and welcome. In this video, we're going to be talking about reversing chronic skin conditions using concepts in European biological medicine, primarily an understanding of homotoxicology and how the six-phase system of understanding disease progression in any system of the body. In this particular, we're going to be talking about skin conditions, how an understanding of that can be utilized to reverse any skin condition and achieve ultimate health and wellness for yourself or your patients. So just a quick disclaimer that all the information in this video is going to be for informational and educational purposes only. My name is Dr. Mark Evanitsky. I'm a naturopathic doctor and acupuncturist specializing in European biological medicine, a system of holistic medicine that aims to really address the root causes of chronic disease and remove obstacles to cure. European biological medicine is a framework developed primarily in Germany over the last 100 years that really seeks to remove obstacles to cure. The fundamental belief being that the body is natural ability, natural desires to heal itself. And when we remove obstacles to that, we can reestablish self-regulation, self-management, and self-healing. And the way we do that is by addressing those root causes, one of which primarily is toxicity in the body. We'll talk more about that. So some fundamental concepts in European biological medicine. Chronic disease is always an issue of toxicity in the body. When we talk about toxicity, we're talking about the overall toxic burden, accumulated toxic burden of both endogenous and exogenous toxins we produce in our body, and then toxins that we receive from the environment. The accumulated toxic burden over time is what leads to degeneration in the hormonal system, the nervous system, and eventually we have a breakdown in the immune system, we break down cellular degeneration and eventual organ failure across the board in every system. And using the theoretical framework of homotoxicology, we can see that progression within every compartment of the body. And in this video, we're going to be specifically focusing on skin, but we can apply the same concept to any system in the body. And so by working to detoxify the body and supporting detoxification, lowering the toxic load, we can help to reverse the progression, then also reverse the degeneration that happens in each system. And we'll go over how that happens within the skin. So homotoxicology is specifically a framework utilized by European biological medicine, developed by Dr. Heinrich Reckeweg. And it combines concepts in classical homeopathy applied to a modern understanding of biological science. It reviews chronic disease as the buildup of toxicity in the body and its attempts at removing the toxicity and the body's attempts at healing are what generate symptoms we have within each system of the body. And by removing those toxins and lowering toxic burden, we can reverse that. We have this framework of the 6 phases of disease. We'll go over that more in detail, but they're broken up into three major sections: humoral phases, matrix phases, and deep cellular phases. And we'll talk about how each one toxicity in each of those compartments and movement along that spectrum increases disease progression, and then increases also complexity and also chronicity of disease. And we'll talk about that. And treatment really is underlying detoxification, supporting detoxification of the body. We use different remedies that are targeting the organs of elimination or to support the organs of elimination so that we can reverse the toxic load and restore balance to the body. So this is the table. It's a theoretical framework when we're looking at different systems of the body. And when we look at from left to right, we're looking at deeper and deeper levels of intoxication in the body. Higher and higher loads of toxicity as we move to the right, and affecting different cellular compartments, which we'll get into, but then also within each organ system, we can see that progression. So today we're going to be specifically focusing on the skin, but in future videos, I'm going to be going over all the systems so you get a better understanding of how this works. So a really important concept to understand is also the cellular matrix, the extracellular matrix, also known as the ground regulation system. This is a compartment of the body that touches every cell in the body. It's basically the surrounding environment, or the milieu, or the surrounding environment that the cells live in. So cells are constantly excreting into this space, and the body is constantly detoxifying and removing toxins from the space, metabolic waste from the space, using the lymphatic system. And so this space is also where we all store toxins. So by eliminating toxins in space, we can help to reverse. But when we look at understand concepts within the 6 phases of homotoxicology, we're going to be looking at how toxins start progressively increase deposition within the space and then eventually within cells. So understanding of how this space surrounds every cell in the body is really important to understand. So initially we have more superficial layers of toxicity, not as high a load in humoral phases. Matrix phases, we begin to get deposition of toxins within this space. And then cellular phases, deep toxicity, we have toxicity not only affecting the matrix space, we have toxicity affecting inside the cell, and then more critically inside the nucleus of the cell. So we have these 3 phases: the humoral phases, the matrix phases, and the cellular phases. These humoral phases are characterized by 2 subphases: the excretory phase or excretion phase, and the inflammatory phase. And when we talk about skin conditions, the excretory phase we can think of as when we notice detox reactions, sweating. We have the movement. The body is trying to push toxins out. We get an active movement of toxicity out. We don't have any deposition yet. We just have the body's attempts at removing toxins, which is constantly trying to do. In the second phase, we get skin inflammation. Toxins are beginning to build, and we have the immune system, which is being in contact with those toxins, begin to produce pro-inflammatory cytokines and creating an inflammatory reaction. This is across the board when the body is experiencing increasing levels of toxicity. Inflammation is one of the key signs of toxicity in this phase. So we have skin inflammatory reactions. In the matrix phase, we're getting deeper deposition and storage of toxicity within the matrix itself. So we have the deposition phase, which is characterized by chronic skin issues. Then we have the impregnation phase, where we're getting a solidification within this space, impregnation in this space. We have deep tissue skin changes that happen at this phase. The cellular phases, we have toxicity moving even deeper into the cells. We have degeneration that begins to happen. We have a breakdown of tissues in the space, and we have toxicity being deposited within the cells, within the intracellular matrix of the cell. And then the final stage of ultimate breakdown, ultimate toxic burden, is de-differentiation and neoplasm formation. So skin malignant conditions. We have a breakdown of function within the nucleus of the cells, the deepest layers of toxicity that the body can store. We have a breakdown of DNA functioning, DNA replication, and we have the creation of neoplastic state and across the board. So this is the theoretical framework of how we look at skin conditions as they're moving through the different layers of the body, of the different phases within the matrix and within the cell itself, and it gives us an understanding of how this movement is happening. So not necessarily you're going to see symptoms within each phase, but we think of these phases as a way of understanding how progressed or how severe the toxicity is for a particular case. And so the movement of toxicity is called progressive vicariation. It's further and further deposition and concentration of toxicity within the space, within the skin. And so we have, again, the excretion phase, we have sweating. Inflammatory phase, we can think of acute dermatitis and acne. There's an inflammation that's happening, but there's not a deeper penetration, deeper deposition happening yet. In the matrix phase, we have the deposition phase, where warts and superficial growths, the body's starting to try and is accumulating toxicity, but it's trying to encapsulate it, trying to hide it in a deposition manner. So then we have impregnation, where we're getting a breakdown of the immune system. So we're getting more and more toxicity within the space, and the immune system immune system which lives in the space is beginning to become even more inflamed, chronically inflamed. We have chronic allergies in this phase. In the cellular phases, we're getting even further breakdown. We have degeneration phase. We can think of autoimmune conditions in this category: psoriasis, scleroderma. We're getting a deep breakdown and degeneration that's happening within the skin. In the final phase, de-differentiation. In the neoplastic phase, we have things like malignant melanomas, basal cell carcinomas, different carcinomas and melanomas that can happen at the ultimate level of nuclear breakdown. So we see this movement. Now, so necessarily someone who's had a melanoma necessarily will have manifested in these other layers, but it gives us understanding of how a progression in concentration of toxicity is going to manifest in different people in different ways. You have natural predispositions to ability to detoxify, the ability to move toxins out. For some people, it's more difficult than others. Some people are more genetically prone, especially in the skin, as a weakness to develop these but it gives us an understanding of how the flow of toxicity in deeper layers causes these issues. And again, so the progression of toxic load, as we get deeper and deeper, we're getting more and more toxic, we're getting a concentration of toxicity. The biological index is a great way to measure toxicity within this space. The matrix itself is a very difficult space to measure. If we're talking about overall matrix space of toxicity, we can measure toxicity through urine, through blood, through hair analysis, but it's not giving us a good idea of the overall total average toxic body burden. So really the best way to measure biological score is through muscle testing or through some form of energetic test that gives us an idea of a rough number. But even if you didn't do that type of testing, you would know through this framework that if they are dealing with a chronic, debilitating, and severe skin condition, we know that we are dealing with higher and higher levels of toxicity by the definition of homotoxicology. That's just what is going to be the case. So when we talk about toxins, we talk about the total accumulated body burden of endogenous and exogenous toxins. Toxicants referring to man-made, toxins, more biological substance, but both really referring to substances that are affecting the normal functioning and the breakdown of normal functioning in the body across all lines: protein metabolism, through cellular metabolism, hormone function, nervous system functioning. All these toxins accumulate, and in the skin, they create those conditions we just talked about. So another model of looking at how we get this progression of toxicity. First, we have the extracellular matrix space that surrounds every cell, and in the skin, we're talking about the epithelial cells, and we have a greater and greater deposition in this space, a breakdown and normal functioning of this space, and breakdown of the immune system in this space, and we get deposition within the cells, we get a further breakdown, and eventually we have deposition within the nucleus of the cell, and we get ultimate breakdown, which is that neoplasia. The matrix phases, these two phases in the middle, are really the key turning points. If we can get treatment here, we have a much better prognosis of reversal than if we're dealing with down here. If the patient's already dealing with neoplasm and severe de-differentiation, you can still treat, you will still see progress, but it's important to understand that this is a long-standing toxic buildup, and to reverse it overnight is not going to be possible. And you're talking about longer-term treatment to reverse the type of deeper toxic penetration. So matrix phases, we like to work here are ideally even humoral phases, because even prior to that, when we're talking about ultimate prevention, we're lowering toxic load before we get a buildup into these deeper layers. So ideally, we're working with patients in matrix phases. And so again, just another schematic of the extracellular matrix. Important to understand the immune system, nervous system, circulatory, and lymphatic system all interface and meet at the extracellular matrix space. It's the most important space in the body to really fully wrap your head around and understand, because once we understand detoxification in this space, we can understand how we can reverse and remove toxicity and reverse chronic illness. So when we talk about reversal of chronic disease or regression of the toxic load, we're talking about movement away from toxicity, from deeper storage, deeper layers, into excretion. Through this, also known as regressive vicariation, through this process, we necessarily have to go through the inflammatory phase. As we're moving out of those deeper layers, inflammation is actually a good sign. We refer to these as detox reactions, as an inflammatory reaction. So we may see some increase in inflammatory symptoms with the skin. We're talking about increase in rashes and inflammatory manifestations in the skin, because that's just the nature of how we remove toxicity through the body. So as this happens, it's actually a good sign. The body starts to sweat, the body starts to mobilize toxins out of the body, and this is necessarily a good sign. And this is the movement of toxicity out of the body, is how we're able to reverse chronic disease. So by supporting detox, supporting the lowering of the toxic burden, we're necessarily moving toxins up and out. We're decreasing the biological score, biological index, lowering toxic load, and then able to reverse through this manner. So again, the biological index score is a score developed by Dr. Helmut Schimmel, a German scientist, that basically looks at a scale between 1 and 21 as the average total toxic body burden for the patient. So we want to get from higher and higher levels to lower levels. We're seeing toxic high levels, we're dealing with chronic disease. We want to get down to ideally around 9 or 10 is an ideal area to be at for a healthy person. You're never going to really get down to lower levels just because of the nature of the world we live in, but if we can get them down to 9 or 10 or below, that is ideal at And then when we do that, we see that the patient's improved. We see that the manifestations are becoming eliminated and the chronic disease is being reversed when you see this movement away from toxicity. So how the body processes the flow of toxins out is the lymphatic system, which touches the extracellular matrix space, is able to pull toxins out of that space to lower the toxic burden. And then the lymphatic system deposits within the liver and kidneys for processing out of the body as urine and stool. So this is the normal flow of endogenous and exogenous toxins out of the body. So we want to support this normal flow in order to get a global lowering of overall toxic load. The goal of any European biological medicine treatment is to mobilize deep toxins out of storage through the lymphatic system and getting processed out of the body. So just to look again, we want to move out of these deeper cellular levels, cellular phases, to get into the humoral phases. So we're going to have a temporary inflammatory reaction to understand that that is the way that we're able to move toxins out of the body. And so the three pillars of European biological medicine, detox and drainage, is really the basic fundamental pillar, because it addresses this core key concept within homotoxicology of lowering toxic burden. And it's really important to understand this, because I see a lot of practitioners get into European biological medicine and get excited by the newest, coolest trends, and they get distracted by the underlying fundamentals of the medicine, which is really to address the toxic burden, toxic load. So we can see a tremendous amount of improvement when we work on detoxification and drainage, and then we can start addressing the other layers. So the other levels are immune modulation. We work on any changes in the immune system that have occurred because of long-standing toxicity. And antimicrobials, we work on any chronic infections that are still manifesting in the body once we detoxify the body first. And then we want to work on organ regeneration and support at rebuilding and rehealing any damage that's happened over long-standing toxicity. So this is the natural flow within European biological medicine. But again, the key foundation is drainage and detox. And many times when we work with detox and drainage, we don't need to then even consider those higher levels, because the body is able to take care of those on its own. So again, drainage is a foundational piece to European biological medicine. We work with different remedies, both oral and advanced forms, IV and injectable form, that are working to stimulate and support and send blood flow energy to the main organs of elimination, primarily the main four organs of elimination: lymphatic system, kidney, liver, and gut. By supporting those organs, we're helping to support the natural removal of toxicity, reversive vicariation, and able to reverse those chronic, long-standing skin conditions. One of my favorite companies to use is Nestman. Nestman is a really great company. They have 4 really great products for the main 4 organs of elimination: A hepatica, lymphate drops, Solidago, and absinthium. These are great to start with, and you can start doing drop dose depending on how the patient's doing. You could do low dose, start with 5 drops or go up to 20 drops, and then watch for reactions. Always with these remedies, you want to be watching for an inflammatory reaction. It's a good sign things are moving in the right direction. We also want to make the patient comfortable and not have too much inflammation, so we can lower the drops if we're seeing too much inflammation happen. If they're having too many skin reactions, we want to reverse that. We want to prevent that by lowering the dosage that we're doing. Another great company I love is Guna. Guna has really fantastic products. Also a product for the matrix itself. Deep Cleanse is a product for liver and kidney support. Lympho Detox, a lymphatic product. Bowel Plus for the gut remedy, and Matrix Detox, which is a remedy that's supporting primarily the lymphatic system within the extracellular matrix, but also has some key components and ingredients which are really fantastic at further supporting detoxification within the matrix itself. So we use these in combination, and we think of, depending on the level and the severity of the skin condition, we want to think of using this for a long time. And this is something that once we have an understanding of, we want to be doing this constantly throughout the patient's life too, because I, for example, myself do twice a year, fall and spring, do a 30-day round of drainage remedies to help support my organs of detox and lower my toxic burden. And you can think of that as a maintenance, but then when they're dealing with an issue, we want to help potentially be on drainage remedies for a while, up to 3 months or longer, and keep working with it as their symptoms improve and their conditions are reversed. They're all within drainage itself. There are specific skin remedies as well. These are things you could layer on top of the drainage you would be using for specific for the organs of elimination. There are remedies within different companies that support topical use, as well as use for inflammation and internal skin support. Discrasin from Cellular, Apis homochord, Graphite's homochord from a company called Heal. IL-10 and FGF guna remedies, Dercut ointment and drops from Picana, and Unda 270 from Soroil, all fantastic remedies for skin that you can layer on top of or after using those primarily for organs of drainage support for organs of elimination. These are really fantastic books I use for references that I highly suggest you look into if you're interested in learning more. If you want to take my free masterclass on European biological medicine, I highly suggest that. I go over all these topics, give you a bird's eye view of the medicine, and give you some resources and tips and tools on how to further your understanding of European biological medicine. And you can register for that with the link in my bio. And then also I have an intro to drainage course with over 7 hours of lecture on European biological medicine's approach to drainage. Go over different companies, go over specifics on how to take drainage remedies, how to administer it, what to look out for, different companies, how to get the remedies. There's difficulty a lot of times getting the remedies in from Europe to the United States. So I go over that in depth. It's a really great foundational, fundamental overview of drainage medicine. And if you're a natural healthcare practitioner, I highly suggest you take the course and start implementing these with your patient's skin. You're going to see really great results across the board, specifically for skin, but then also with any other condition you want to work with. So if you have any questions, you can message me, DM me, or comment below.